Hello, my name is Alina Kamara, and in my presentation, I would like to talk about the fight against COVID-19 in my home country, Sierra Leone. As we all know, the novel coronavirus COVID-19 started at the end of 2019. It spread rapidly around the world, and countries faced many challenges in preventing and managing the spread of new virus within and across borders. But some countries had already faced major outbreaks of infectious diseases in the past, most notably the 2013 to 2016 Ebola outbreak in West Africa. Like COVID, it affected multiple countries and urban settings. Health officials and scientists dealing with Ebola outbreak gained valuable experiences. For example, they gained an appreciation for the role of health education, dissemination of correct information, raising awareness and sensitization in controlling the spread of the outbreak. These lessons highlighted the gaps in the country's response and are key to preparing for emerging disease outbreaks. Sierra Leone, with other countries hard hit by Ebola, had several deployments of treatment centers and training of frontline workers in infection prevention and control. The revitalization of the country's disease surveillance system, the establishment of emergency operation centers at both national and district levels, and the development of strong networks to support community outreach and mobilization also played crucial roles in putting the country in better shape to withstand the contagion. During the Ebola, the International Organization for Migration conducted a worldwide program on infection prevention and control training for frontline workers. Officials at border points established water, sanitation, and hygiene surveillance systems at key points of entry and community engagements on hygiene practices to break the chain of transmission. When COVID-19 broke out, these measures were immediately upgraded and applied to stem the propagation of disease in the country, even before the first cases of COVID-19 was signaled in the country on 31st March 2020. The International Organization for Migration worked closely with Sierra Leone's Ministry of Health through emergency operations centers set up during Ebola crisis to support the country's preparedness and response to COVID-19. Sierra Leone developed a COVID-19 preparedness plan 3 weeks before its first cases was confirmed. This enabled the Ministry of Health to quickly identify, test, and quarantine most of the primary contacts of index cases, thereby limiting spread of the disease. The government produced crucial geospatial data sets, analysis, and tools to support the COVID-19 response in Sierra Leone. Timely, high-resolution geospatial data helps to accurately analyze where highly mobile and densely populated areas are. The analysis also highlights areas of risk where it may not be possible to maintain physical distancing recommendations, like, for example, in informal settlements or markets, and additional precautions might be necessary. The International Organization of Migration conducted a rapid vulnerability assessment of the 16 districts of Sierra Leone in collaboration with the Ministry of Health. At the ministry's request, the IOM trained and deployed 60 community health workers equipped with infection prevention and control materials to conduct health screening and communication activities at prioritized locations such as ports and ground crossing points in 5 of the country's districts. IOM's priority was to reinforce and reactivate health screening at high-volume informal crossing points in coastal areas, as well as wharf in border areas with high economic activity where people from neighboring Guinea and Liberia continue to enter Sierra Leone despite border closures. Hard-to-reach border communities and coastal areas are particularly vulnerable to COVID-19 because of limited access to information and lack proper healthcare infrastructures and personnel to adequately screen and quarantine suspected cases. To ensure that everyone has access to life-saving information, the IOM works with youth, community leaders, and returning migrants to raise awareness on COVID-19 preventive measures in these areas. Returning migrants also join the fight against COVID-19 and encourage communities to adopt and respect preventive measures. In a region known for its porous land borders and high degree of cross-border trade, disease surveillance and health screening are key to detection and referring potentially ill travelers to adequate healthcare structures to limit the spread of any disease. So, as we see, Sierra Leone's major strength in halting the spread of Ebola and COVID during the outbreak was massive health education and community involvement in the design of virus control and prevention strategies. Thank you all for your attention.